Hello everyone, and welcome to my YouTube channel. I'm your favorite medical microbiologist and your favorite health professional, Gwendolyn Halley. Today I'm going to teach you a little bit about deworming. Deworming is an important exercise that needs to be done by both adults and children, especially with children. And how do we come about with worms in our system? We can get this through contaminated food or contaminated water. That is, the water may contain the eggs, or the food may contain the eggs, or the actual worms themselves. Now, what are the type of worms that actually infect the human gut or actually thrive in the human body? We have the roundworm, the tapeworm, the hookworm. These three worms are more popular amongst others that exist, and they have a very nasty way of behaving in the human body. Now, what are some symptoms that you're going to have if you have any worm in your system, particularly the roundworm, the tapeworm, and the hookworm that live, amongst others, that live in the human gut? The first thing is you have itches on your abdomen. Itches on your abdomen, which is caused because the worms release toxins. You have itches on your abdomen. Sometimes you have rashes on your hands caused by the toxins of the worms. You have like round, reddish, depending on your skin type, but if you have melanin, it's going to be red. Like if you're too dark skinned, it may appear in a different color. If you're a darker shade than I am, you may actually have the rashes appear in different colors. But know that these worms release toxins and they cause discomfort in the abdomen, pain in the abdomen, movements in the abdomen, and these rashes also, which is also caused by the toxins that these worms release. And also ulcers. These worms could actually begin to bruise your intestinal walls, your stomach walls, and you would get ulcers, stomach ulcers, which isn't very good. Remember that the tapeworm can be as long as 4 meters. So you're talking about a parasite and a microorganism that loves to thrive in the human body. Hallelujah. And another point is it may also cause sudden weight loss. That's because the worms will begin to feed on your nutrients. Let me say you're eating and the nutrients don't get absorbed by the body because these worms are actually enjoying the meal. Enjoying all the minerals and nutrients that you are putting in your body. They are taking it into themselves and they are growing and thriving. Another is coughing. We actually have a worm, particularly the roundworm, that can move from the stomach, from the intestines, right into the chest. So this is very, very dangerous. And that is why we need to take a deworming program, personal deworming program, round the year. Whether you're a kid or an adult, male or female, it's needed. You can also have blood in stool, which is caused by hookworm. The hookworm can also perforate your intestinal walls. And if you don't see blood in stool, you will see your stool darkish. And when you have darkish stool, it may imply that you have old blood that has been entered into your intestines or into your larger intestines and it's coming out through the anus. So actually you may have bloody stool, but you may not see it immediately, but you have darkish poo. And these are things that we need to be aware of. Now, how do we go about deworming? If you have children, because children play around, touch from 2 years old, they move around, they touch the floor, they touch the ground. You cannot stop a child from putting the fingers in the mouth, and they are innocent, or from drinking this water. And sometimes in the split of a second, they have touched a dirty place that may have the eggs of these worms and put it in their mouth. This is why it's important to deworm your children after every 3 to 4 months. Deworm them. I mean, children have their own deworming medications. I think it comes in liquid form, and there are different brands or trademarks that do that. So deworm them after 3 to 4 months. And if you're an adult, it is good to deworm yourself after 6 months. And for the adults, this is what I have been taking: albendazole. Albendazole is a very good, you chew this and you drink water. It's not bitter actually. This is 400 milligrams and it's quite good. If you take this today, you take the next after 1 week. That means you buy these 2 packs to have a complete treatment. You take, in this is 1 tablet. This is 1 tablet. I've taken this already. You take 1 tablet today, or the day you choose, you decide to take it. And then after 1 week after you've taken the first tablet, you take the next. And you do that again after 6 months for an adult. If you are someone who eats out a lot, who eats a lot of food outside, maybe the food may not be cooked well, the food may be contaminated, water, you drink out a lot, you don't cook your own food, and the food is not cooked properly, because most times when we cook our food personally, we try to cook it properly and we are more cautious about our hygienic condition or the hygienic condition of the food that we're eating. Unlike when we are eating outside or out of our homes, we are not really sure of the hygienic conditions of this food. This is why if you're somebody that eats out a lot, I will recommend you do this deworming process 3 times a year. Like say after 3 months you deworm, or 3-4 months you deworm, and that's good. And if your child plays out a lot, or is at an age where the child is going to school and the child plays around a lot from the age of like 4 to like 8 or 10, it is good you do deworming on them after 3 months. And this is for adults. This is for adults. So I think you have to get the pack for the kid to your age. And this is very good. So it will clear away the parasites. Albendazole, it will clear away the parasites, and it's not bitter at all. You can get the same brand of this and for children and give, because I quite like it. This is what I take every after 6 months, or when I feel that I've eaten a lot outside, I drink a lot of water outside, I do take this because I want to stay healthy. I don't want to be experiencing a lot of abdominal aches. A lot of people who do self-medication, who just feel that every abdominal movement that they have, or any abdominal pain they have, or any sort of ulcer that they have could be caused by bacteria, mostly typhoid, the typhoid bacteria, and go around taking typhoid medication. Maybe it could cause by an E. coli, it could cause by something, and they go around taking other bacteria medication instead of thinking that they could just put themselves on disciplined deworming treatment all through their lifetime. This will be very good, especially if you don't buy bottled water or treated water, or you take water from your community, either from the same pump or from the same tap, and all you do is filter. Most times the filtering process that you use do not collect the eggs, do not filter out the eggs. So this is why it's very important. And to a certain point, you can have people who have a bloody stool and they're thinking it's something else. And these toxins that are produced by these worms can actually give you fever. They can actually make you malaise. You could be thinking you're having typhoid fever, but or some other abdominal infection, but it is actually caused by a parasite, a worm. This is why it's very important, and I think I'll do another video on it, explaining the disadvantage of self-medication. You could actually cause drug resistance, and it is not good. Self-medication without proper tests, microbiological tests, stool testing, isn't good. That is why they are there, to stop bacterial resistance, stop drug resistance. So, guys, and how do we prevent worms from getting into our body? The first thing is that we should have a very good waste disposable system, especially if you have children at home. Do you have pit toilets around? Do your children move around in pit toilets, even adults? When you go to the toilet, do you put your hands in your mouth? Do you wash your hands after going to the toilet, public or private? Because you don't use your toilet alone. These are things you should consider. How do you dispose of your waste? When your child pulls in the diapers, how do you throw the diapers, the used diapers, away? Do you just put it in any trash? How do you wash your hands after that? How do you sanitize your environment? Firstly, you need to have a proper waste treatment. That means the way you treat your waste, particularly stool, even food, even meat, should be so good that it doesn't cause a breakout of worms in your home. Next point is wash your hands properly. Very important. Wash the hands of your kids properly. Get into the habit of washing the hands. Now, I would like to say something. Most of our antibacterial hand sanitizers do not sanitize or do not work against parasites. I need to say this, it's mostly for bacteria. They do not kill the eggs of parasites. That is why hand washes is the best. Yes, we have hand sanitizers that do the work, but hand washing is the best. Next point is cook your food well. Make sure when you buy meat or when you buy your veggies particularly, you cook it well. Because 90% or plus 99% of the eggs of the worms, that the hookworm, the roundworm, the tapeworm, and amongst others, and their eggs cannot resist high heat. Heat plus above a certain degree of 100 centigrade or 70 degrees centigrade. Next point is sterilize your water. Do not only filter your tap water through a filtering, let me say like the filters containers that we buy in the supermarkets to filter water, but also if you can drop, some people put in a little bit of bleach in it and stand it for a few days, and bleach is going to kill the eggs. What is very resistant here is the eggs. The eggs have a very tough kind of cell wall that prevents a lot of chemicals from penetrating, prevents it from dying easily. So that is why it is very important cooking the food well. If you can boil your water, yes, you can boil. If you have a form of chemical that you can drop in your water to kill particularly the spores, even better. But make sure that you take this preventive method in order not to be using this medication all the time. But this is also good. Also, this also works as a preventive. If you're taking this albendazole every 6 months, you're actually also preventing. It's not a prevention. You're actually killing also the eggs of the worms that are present. And so far, when I took this, I didn't have any like major side effects. So this is very good. I will recommend this drug to you because I've taken it. It's chewy, and just chew it a bit and you drink some water. If you have enjoyed this little teaching, please give it a thumbs up and share this with a family, a friend who can benefit from this information. And if you are a returning subscriber, I want to say thank you. Thank you so much. I wouldn't have gone this far without you. And if you're just joining this channel, please subscribe because there's a lot more. There's so much about health. And what is good about my teachings is that I teach more of lifestyle medicine. That means that you develop a healthy lifestyle to solving your problem than using medication or drugs or chemical drugs. That even if you're using chemical drugs, you are using little or no, that is maybe 1 or 2, but not a lot. That means you can tweak your lifestyle around and actually live healthy and longer and happier. Till next time, I'm your favorite health professional, Gwendolyn Halley. Bye-bye.